Well, New York City's heat emergency plan in effect today, as we could see triple-digit temperatures this afternoon. Staying hydrated and cool is going to be key, but that will be tricky for residents on Manhattan's east side, where 76 buildings have tested positive for Legionella.
Yeah, and this morning we have another outbreak to worry about, right? Hundreds of New Yorkers have been infected with an extreme case of food poisoning. It's called cyclosporiasis, and here to tell us what it is and how to avoid it is New York City Health Commissioner Dr. Alistair Martin. So, Dr. Martin, great to have you here in the studio. Good to see you.
Thank you so much for having me.
You've had a busy few weeks and add on a heat wave upon heat wave on top of that, right? But let's begin with one thing at a time and talk about the Legionnaires outbreak and where we are in terms of the infected and the hospitalized. Now, the numbers are going up. I spoke to the mayor earlier this week who said on Monday that he thought the numbers were stabilizing, but it seems to have made a significant jump. So where are we in the numbers?
Here's where we are so far, Dan. So we were lucky to catch this early. We moved quickly, and we have not stopped since, right? This began for us on July 2nd, a couple Thursdays ago. And where we are now, as part of the investigation, is that we are seeing patient cases decline. More than half of all patients who have been hospitalized have been discharged, and the epi curve is resolving. So folks can go online and see where we are. So for instance, yesterday we had one case that was confirmed. And so we are in a reassuring position.
So
things are getting better.
Patient cases are declining while building testing positive are increasing. Can you explain the difference?
Absolutely. Let's talk about the buildings. So number one, the entire radius here was about 183 cooling towers. Just to keep in context, last year in Harlem, there were 47 cooling towers. So over 4 times the amount of space that we're looking at in this case. And then in terms of the orders to clean, drain, and disinfect, in total, we've had 57 that have gone all the way through the process, which is really taking that Legionella bacteria off the map and going and cutting it off right at the source. We have 19 more that need to get that done by Thursday, but the vast majority of these towers have followed through, which is good. They've complied. And that's why I think we're seeing reassuring signs in terms of the patient cases and in terms of that epi curve flattening.
Okay. One of those buildings that did test positive for the bacteria do include the Met Museum that is closed right now while they do that disinfection process. Do you expect the list to grow for those buildings?
That's a great question. So where we are right now is 76 total buildings have been named, and we've released all of those names. For the first time ever, we decided to release all of those tower names at the PCR positive stage. What does that mean? That means that we tested the water in each of those towers, and we identified that there was DNA that's linked to Legionella bacteria. Now, we can't tell if that's dead bacteria or live bacteria, right? And so of the 76 that we have, the majority of those are not going to have live Legionella bacteria, right? But we decided to be aggressive, the most aggressive posture we've ever taken, to just jump on this early and take that source out.
Yeah, there's been a requirement from the city now that these buildings have to test for every 31 days.
You got it.
So with seeing 76 buildings test positive, have they been actually doing that testing every 31 days? And if they aren't, how would you know? And is the city inclined to issue fines for buildings who aren't following that law?
We have some of the most strict and protective laws around Legionnaire's disease here in the city, and we're grateful to work with city councilors all across the city to make sure that we have those laws on the books. And every single year, we issue countless violations to landlords that don't comply to our orders.
But how do you know if they're not?
So here's what we know so far. In terms of May, right, we have this brand new law. The vast majority of cooling tower operators have complied. They've given us the required information. The small segment that have not complied, it could be because their cooling towers are not operating yet. For the ones that have a cooling tower that's operating and they have not complied, there absolutely will be consequences.
Right. So you mentioned the process of sourcing this. It involves DNA testing. It's a very cumbersome and intense process here. In the meantime, while you guys try to find the source, how can folks remain safe?
Yeah, you're right. You know, let's talk about some of the testing because it is a little bit nerdy. I just want to make sure folks have a sense of what we're doing and why, right? So the PCR testing, again, is trying to see if there's DNA evidence of Legionella bacteria. Now, some of those cooling towers are going to have dead Legionella. Some of them are going to have live. The live ones are the ones that we are really worried about, and that culture result will come back in the next week or so. We then are going to do a step called whole genome sequencing, which is where we're going to then look at that bacteria DNA and the test results that come from the patient and see if we can identify a positive match. But what folks can do in the meantime is, if they live in those 3 zip codes, 10028, 10128, or 10075, and they have things like cough, fever, shortness of breath, they have to go see a doctor and get evaluated, because this is eminently treatable, and that's what the data is showing. The vast majority of people who get diagnosed so far have been able to recover and make it home.
Okay. I do want to move on to cyclospora here, and that is the kind of the people who are just afraid to eat berries right now, and it's kind of all over social media, this parasite that's it. Do we know the source of it, and what is your recommendation really for folks who are withholding their fruits and veggies from themselves and their kids at this point in time because they're afraid of what's going to happen?
Yeah, so here's what we know so far. So we're tracking over 400 cases of cyclosporiasis, and that's 3 times more than we had this time last year. What folks need to know is that we are working closely with the feds, with our state partners, to identify what the potential sources are. Now, typically, this is fruit or vegetable borne pathogen, and washing your fruits and vegetables can help. It can reduce the chance of an infection, but it's not a guarantee, right? And so what folks need to know is this is eminently treatable. Vast majority of folks who get this actually have a resolution with no antibiotics. But it is certainly something that's uncomfortable, and we want to get to the bottom of this.
Yeah, it's a rough go if you do get it, that's for sure. We know this outbreak is happening all over the country. Michigan has been identified. Where does New York stand?
Yeah, well, where we are right now, as I mentioned, is we have identified those 400 cases here in the city, and we're working closely with our state colleagues to identify if there's potential data that's letting us know, is this something that's an upstream distributor, right, like some kind of national source, or is this something that's closer to home? At this point, we don't have that information to be able to share.
Yeah, those 400 cases, is it much like Legionnaires where you have a cluster or a zone? Are you seeing it kind of widespread across, or is there a specific area that maybe you can look at a place where people are buying fruits and veggies and say, okay, this might be an area of concern?
It's a great question. It's a great question. It doesn't work in the same way as Legionnaire's disease, right? Legionnaire's disease, we sort of put the cases on a map and then we identify a radius around that. This is what we're seeing, sort of what we call sporadic. So they're all over. Yeah, in terms of the next steps here, every one of those cases, we are getting on the phone with the patients who are involved to do a history, to do an investigation, to identify, are there any common patterns? Did you all eat at the same places? Did you all eat the same kind of food, same fruit, same vegetable? And so we're trying to put that sort of puzzle together right now.
Are local farms safer than, let's say, going to a grocery store?
It is safe for folks to be eating fruits, safe for folks to be eating vegetables. It is important for folks to be washing their fruits and vegetables.
So you don't avoid them?
At this point, what I would say is it's important for folks to wash their fruits and vegetables, and cooking, we know, is absolutely the thing that's going to be able to eliminate the risk fully.
What should we be washing the fruits with? What is your best guidance for that?
Absolutely vigorous water, so like putting it under vigorous, putting it under the tap and really making sure to wash it thoroughly.
Okay, apple cider vinegar. Baking soda.
That's right. You want the recipe.
I want your recipe.
You want the recipe. No, I think as this evolves, we'll have some more information in terms of what exactly needs to be avoided. But at this point, we're not issuing any broad-based guidance for folks to avoid fruits and vegetables.
All right, Doctor, you're eating them. We're eating them. Okay. Thank you. It's a hot day. Quick. We're out of time, but quick advice for New Yorkers who are navigating around the city on a hot day like today.
Look. Heat is one of the most important environmental emergencies that folks in this city face. Every year, about 500 individuals die from heat-related illness, and it's so important that folks get inside, get to a cool, air-conditioned space. Every single one of these deaths is preventable, and this administration is taking a more aggressive posture than we ever have when it comes to preventing heat death.
You covered a lot. New York City Health Commissioner Dr. Alistair Martin, thank you so much for being with us and your insights. We appreciate it.
All right, with that, everybody, we'll be right back.
There's no place like home. There's no place like home. There's no place like home. At NYU Langone Health, we get our surgery patients home sooner than any other health system. At NYU Langone Health, a single electronic health record gives you access to all of your doctors, lab results, images, prescriptions, and visits.
It's always something.